Hi, I'm Nick Parrish, and I'm one of the pharmacists on the UC Health Transplant team. We're going to review some of the key information about the commonly prescribed medications following transplant. This video is meant to be a general guide. It is not all-inclusive. Additional information will be provided by the transplant team before you leave the hospital and within the written educational materials you receive. Be sure to always contact your transplant coordinator if you have any questions or concerns regarding your medications. This video will review the following information for the most common medications you will be taking post-transplant: the purpose, the usual dosage and dosage forms, the best way to take the medication, the most common side effects, and other important tips to help manage your medications. First, let's talk about the immunosuppression or anti-rejection medications. Tacrolimus is an anti-rejection medication, sometimes called by its brand name Prograf. It's taken twice daily every 12 hours. It's important to take tacrolimus consistently at the same time every day to ensure a stable level of immunosuppression. It may be taken with or without food, but you should be consistent with regard to food. In the beginning, you will be taking medications, so we recommend taking your anti-rejection medications consistently with food. Your dosage will be determined by the level of tacrolimus in your blood and will change frequently. You will be instructed to have blood tests done to measure that tacrolimus level in your blood. Blood levels are monitored in the morning and should be drawn within 1 hour before taking your dose. This is called a trough level and is the lowest level of tacrolimus that is present in the blood. If your trough level is outside the desired range, we will instruct you to increase or decrease how many capsules you take. So if you take your tacrolimus at 9 a.m. and 9 p.m., when should you have that blood test done? A, between 9 a.m. and 10 a.m., B, between 8 a.m. and 9 a.m., C, anytime, or D, after the morning dose is taken. The blood test to measure is the trough, or lowest level in the blood. This should be done within 1 hour or less before taking your dose, so answer B is the best choice. On the days you're having blood tests done, you should not take tacrolimus until after your blood is drawn so an accurate trough level is obtained. Be sure to bring your dose with you to your laboratory appointment, along with the other medications you take at that time, and then take them right after your blood has been drawn. You may also wish to bring a snack so that you have food in your stomach when taking your morning medications. The most common side effects of tacrolimus vary and are usually related to the level of the drug in the blood. They may include nervous system or neurotoxicities like headache, insomnia, or numbness or tingling of the hands and feet, kidney dysfunction, and high blood sugars. Mycophenolate or CellCept is another anti-rejection medication. It's usually taken twice a day and may be taken with or without food. Doses should be evenly spaced, taken 12 hours apart, for example 9 a.m. and 9 p.m. Mycophenolate should not be taken at the same time as antacids in order to prevent rejection most effectively. The most common side effects of mycophenolate include lowering the number of white blood cells in your body, nausea, stomach irritation, vomiting, diarrhea, and may also cause birth defects, so birth control is required in females with reproductive potential. Prednisone is the third anti-rejection medication that most of our patients receive post-transplant. This medication is taken once daily in the morning. The dose of this medication is gradually decreased or tapered over time. The length of time you will take this medication varies and may be from several days to several months, but is eventually discontinued in most of our patients. You should continue the same dosage until instructed by the transplant team to change your dose. Many of the side effects associated with prednisone happen with high dosages and long-term use. And since this medication is usually discontinued within a few months after transplant, you likely won't experience many of these effects. However, high blood sugars are common, and many patients will need to use insulin for at least the first several weeks following the transplant surgery to help control blood sugar levels. A diabetes educator may work with you after transplant while you are in the hospital so that you will be able to check your blood sugars at home and give yourself insulin if needed. You are probably wondering how you'll be able to remember all of this information and be able to take your tacrolimus, mycophenolate, and prednisone correctly. We'll have you use a medication instruction card and pillbox. After you are transplanted, and prior to being discharged from the hospital, a transplant pharmacist or other team member We'll work with you to make sure you know how to take your medications correctly by using the medication instruction card and pillbox. Let's practice now. The medication instruction card is organized with one medication listed in each row and with the medication strength, directions, and times a day you will take the medications listed within the columns. Usually, transplant patients have to take medications 2 to 4 times over the course of the day. Each medication, the dose, how often you take it, and the time you need to take it will be written on the card for you. The card will then be used as a guide to pack your pillbox. The pillbox slot for each medication is provided to help you in knowing where the medication should be placed in the pillbox. For example, you may be directed to place the medications you will take at 9 a.m. and 9 p.m. in the slots marked morn and bed along the top and bottom rows of the pillbox. For this example, let's say based on your daily schedule, we determine that taking your 3 capsules of Tacrolimus at 9 a.m. and 9 p.m. is best. This would be written on the card as you see here, and then checks placed in the appropriate spaces. Mycophenolate must also be taken twice daily, every 12 hours, so we schedule it also to be taken at 9 a.m. and 9 p.m. This would be written on the card as you see here, and then checks placed in the appropriate spaces. We then do the same for Prednisone, which for this example you will also take at 9 a.m. Once the information is complete for each of the medications you are prescribed, we will use this card to fill your weekly pillbox. So let's get started and actually fill the pillbox with your Tacrolimus medication. Remember, for this medication your dosage is determined by your blood level. Let's say you are to take 3 capsules at 9 a.m. and 3 capsules at 9 p.m. This would be indicated with check marks on your card as you see here. The capsules supplied by the pharmacy are 1 milligram in strength, so verify that you have the correct strength of the medication before beginning. Next, pour some of the capsules into the palm of your hand and place 3 capsules in each of the morn slots and each of the bed slots until the entire week is filled. Let's try another one, Mycophenolate. If your dose is 2 capsules twice daily at 9 a.m. and 9 p.m., again, verify the strength of the pills is correct, 250 milligrams in this case. Then place 2 capsules in each of the morn slots and each of the bed slots until the entire week is filled. You will repeat these steps for each medication. Plan to spend 30 minutes to 1 hour each week updating your medication card and filling your pillbox. The medication card and pillbox go hand in hand to provide a system that allows you to take your medications correctly and consistently. Now, let's review the anti-infective medications. You will take these medications to prevent infections in the first several months after your transplant, when infections are most likely to occur. Which medications and the length of time you will take them is different for each patient depending on certain risk factors. Bactrim is used to prevent bacterial infections. Your prescription may be labeled by its generic name, which is a combination of 2 ingredients, sulfamethoxazole, trimethoprim, or an abbreviation such as SMZ-TMP. The strength of the tablet is 400/80, indicating the amount of each ingredient. Bactrim may be taken with or without food, but should be taken with plenty of water. Side effects are not common, but let the transplant team know immediately if you develop a rash, hives, or itching. Patients with allergies to sulfa medications will be given a different antibiotic. Valganciclovir, or Valcite, is the most common medication used to prevent viral infections post-transplant. Some patients will receive other antiviral medications such as acyclovir or valacyclovir. Both Bactrim and Valcite may lower your blood cell counts or cause an increase in your liver or kidney function tests in some patients. It's important to take exactly as instructed and to obtain your routine lab tests so we can monitor for these effects. Fluconazole is used in some patients to prevent fungal infection. It's a tablet that's taken once daily with or without food. Most people do not experience side effects from this medication, but rarely this drug can lead to liver damage. We will closely watch your lab work in order to prevent this from occurring. These anti-infective medications will also be added to your med card and pillbox. For this example, Bactrim is taken as 1 tablet once daily at 9 a.m. It would be added to the med card like this, and you would insert 1 tablet into the appropriate section of your pillbox for each day. As you can see, the square we are placing the Bactrim in also contains the morning doses of anti-rejection medications. Next, you would do valganciclovir or Valcyte, and for this example you were prescribed fluconazole as your antifungal medication. Now we will review some of the other medications transplant recipients are usually taking. Gastrointestinal agents include several medications that suppress stomach acid so that you are less likely to have side effects like stomach pain or ulcers. These medications are usually temporary and may be stopped in most patients after several months if there is not an ongoing need like acid reflux. Side effects are not common but may include nausea, diarrhea, and headache. Instructions may differ depending on the medication used, but they are generally taken in the morning with your other medications. Insulin therapy is used in many patients to control blood sugar levels, which are increased following transplant, usually due to the effects of certain medications. Insulin is given by injections under the skin, often several times a day. If we would like you to use insulin at home, we will arrange for a certified diabetes educator to meet with you and your caregivers while you are in the hospital. The educator will review with you how to check blood sugars and perform insulin injections. Some patients will not need insulin, but will be asked to check blood sugars regularly. We will make sure that you have a blood glucose meter and are instructed on how to use it before you leave the hospital. We realize that checking your own blood sugars and giving insulin injections can be difficult, but it is very important to do in order to prevent complications and potential admissions back to the hospital. We will work with you in order to become more comfortable with this therapy prior to your discharge from the hospital. Pain management is also very important after transplant. Everyone's response to pain is different, and we will work with you in the hospital to find a combination of pain medications that work well for you. You will be asked to take some pain medications around the clock to keep the pain levels more manageable, while stronger pain medications may be prescribed for use as needed. Pain should gradually improve over time post-transplant, allowing you to decrease the amount and then stop taking the medication as tolerated. If pain becomes more intense after you leave the hospital, you should contact your transplant coordinator. As many pain medications can cause constipation, you should be sure to drink plenty of fluids and take stool softeners or laxatives as directed. Medications taken on an as-needed basis should not be put into your pillbox, but we will write these medications on the back of your med card as a reminder that you have them in case you need them. Additional medications may be needed depending on the patient. Your transplant team will assess you for these needs and arrange for you to have these medications. They may include things like blood pressure medications or medications to prevent bone loss. For example, patients taking prednisone may be asked to take supplemental calcium and vitamin D. Since good nutrition is important in your recovery, we may also ask you to take a daily multivitamin. Also, you may be prescribed medications to prevent or treat infections your transplanted organ may have been exposed to. All of these other medications will also be added to the backside of your med card and to your pillbox. A few of them may not be able to be stored in the pillbox, such as insulin, so we'll work with you to develop a system for taking any medications not kept within the pillbox. There are a few other key points about your transplant medications I'd like to review. Always use your medication card. Always refer to your medication card for instructions on taking your medications rather than the label on the bottle. Always keep a copy of your medication card with you. Always take your medications as scheduled. Developing a comfortable schedule that works best with your daily routines will improve your success for taking all of your medications at the right time every day. If we are monitoring blood levels of your medications like Tacrolimus, ensure that blood work is done before taking your morning medications whenever blood work is scheduled. Use a weekly pillbox. Caregivers should be aware that they should wear gloves when handling certain medications if helping to fill your pillbox. Use alarms on your phone or other reminders to take the medications when they are due. Do not stop taking or change the way you are taking medications without discussing with your transplant team. Contact your transplant coordinator with any medication-related questions. As you can see, there are many medications that are needed following your transplant. Many of these are temporary, while others are to be taken for the rest of your life. Successful outcomes post-transplant depend on these medications and you taking them as instructed by your transplant team. Transplant pharmacists and nurses will work with you and your caregivers to learn about these medications while you are in the hospital. You need to make sure that you understand how to take them all correctly before you go home. While the amount of new medications can seem overwhelming, this medication management system of the MedCard, pillbox, and alarms will help you stay on track and give you your best chance for success with your transplanted organ. Thank you.